Hi, I'm Virginia from Right Clinic, and I've been a medical copywriter and content creator since 2020. And before that, I was a pharmacist in London. So I got this question, which was, hi, I just secured my first medical copywriter role. What advice would you give to newbies in the field? So this was a comment on a video where I explained the difference between medical writing and medical copywriting. So if you are brand new to medical copywriting, I suggest you watch that video to understand a bit more about what it is. And so to answer the question, I would say that the first thing I recommend is you ask the client how long you think the project is going to take. So this will help give you an idea of how secure your income will be. So for example, if you are just doing one blog piece, then is that all they want you to do? Or is there a possibility to do a series of blogs? So maybe you could do one blog per month for the next 12 months, or maybe more than that. So it's important to think about how much you're going to make from each client that you start working with, because whenever you start working with a client, you're going to learn a lot about their brand and how they like you to do things. And when they edit your work, you're also going to learn how to write in that style. So it's important for you to actually get a lot out of all of the effort you're going to take to learn about your client. And then you want to make sure that all of that knowledge that you are putting in and you are making the effort to really try and use that for as long as possible. And so try to have a long-term relationship with your client. And one way to do that is to ask them if they are happy to work with you on a retainer basis. So a retainer means that you are guaranteed to have a certain amount of work for a certain amount of time. So like I said before, maybe one blog per month for the next 12 months, and maybe you'll be paid a few £100s per blog in order to, meet a certain amount of income. And then that's also less pressure on you, so that you know that you have that one client for sure, you've got that banked for at least 12 months. Then you need to know that you will have to find at least maybe 3 to 5 other clients, maybe writing other blogs or something like that. So that would be the number one tip that I give you. So try to make sure that you're signing up for long-term work. The second tip I would give you is try to make sure that you are actually named as the writer. So then you can use that work in your portfolio, because when I write stuff and my name isn't on it, it means that I can't use it. So you're spending time creating something that nobody is going to know about, and you can't really prove that it was you that created it. But when you're in that situation, if the money that you're going to get for it is going to be quite good and you don't mind, then that's fine. And also, sometimes people do not want to share who their writer is because the market is very competitive. So they don't want to put your name on it. Or the other thing is that they will put their name on it instead, so as the company. But if you're a healthcare professional, then the advantage is that you can persuade them to put your name on it because you have credibility. So whenever you are writing something, especially if you're going to publish it online, then there's something called search engine optimization, or SEO. And if you're unfamiliar with that, I do have a short course that you can learn about it. I'll link that in the description below. And so one of the kind of pillars of SEO is that you can trust the information because it's coming from someone with authority and with credibility. And that's more relevant now than ever because there is AI generated content. So AI can pretend to be an expert and make stuff up. But if you are actually an expert and you are registered as a healthcare professional, maybe you're a registered doctor, pharmacist, or nurse. And it's also one of the reasons why I keep my registration as a pharmacist, because you do not have to do the traditional job as a healthcare professional. You can do other things. So, and I'm a really big example of that. So you can still practice your knowledge. You can still help people with your knowledge, your medical knowledge. So try to get your name on your work would be my second tip. So my third tip is that you sign a contract. It's so important to sign a contract because if you don't sign a contract, there's no guarantee that you'll get paid, even if you sign a contract. But it's better that you have a contract than you don't, because if you have a contract, then at least it's something that you can both say that you've agreed to, and then you should hopefully be able to get paid based on the contract. And the other thing is that, similar to a contract, you want to have a brief or some kind of agreement where they know exactly what to expect in terms of the work that you're supposed to deliver. So we usually call these like deliverables, is the fancy word. And you need to make sure that you agree what those are so that you get paid after you deliver them. So that would be my third tip. So have a kind of contract and also agreement on your deliverables. So what you actually need to produce in order to get paid. So, and I suppose the final tip is, after all of that, make sure that you've got some kind of testimonial or recommendation from your client, because if you do, then that can help you get more work. And if they do want to end the contract, maybe after 12 months, then you've got something to show for it, and you can prove that you did good work with a client. And then it also opens up the opportunity for them to hopefully refer you on to work with someone else. So getting a referral is a good idea. So that would be my fourth tip: get a testimonial or some kind of recommendation that you can share publicly, and then also ask them for a referral so that you continue to get work. Because whenever you do work, especially as a beginner, if it's your first medical copywriter role, you want to make sure you do a really good job. Otherwise, it's going to be hard for you to get more work in future. And always, make sure that you keep the client happy. And if they do ask for extra stuff, don't be afraid of charging extra for that. So again, that should be something that should be within the agreement that you sign. So anything that is, if they ask for 2 blogs 1 month, for example, then they should pay for that extra blog. It's not like included in what you've already agreed. So make sure you get paid, do good work, and then also get a testimonial or referral so that you can continue to be a medical copywriter. And obviously, in the very beginning, getting your first client is probably the most difficult part. So well done for getting your first client. And I hope it will help you to get many more. If you want to find out more about medical copywriting, then you can check out the course in the description box below. And also the course is available in Spanish, so you can check that out as well. I'll leave the link to that. So thank you so much for watching, and I'll see you in the next video. Bye.